on the next episode of This is Cancer.
These decisions of what best treatment options to offer when our patients desire future fertility, these are some of the hardest decisions that we have to really think through.
This is Cancer.
Brought to you by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
That was a clip of the podcast, This is Cancer, where our next guest shared parts of her story. It's all a part of Cervical Cancer Awareness Month. So joining us in studio today to share everything you need to know is Dr. Lindsay Kuroki. Dr. Kuroki, thanks for being here.
Oh, thanks so much. This is amazing. I'm so excited.
Well, we're excited to have you, especially for something like this. I mean, this might be, it's Cervical Cancer Awareness Month for a reason. It might not be something that people are very well aware of. Yeah. So why don't we first start with what is cervical cancer?
Yeah, just the basics. I think it's always important because the cervix is a part of your body like you just sometimes don't even know where. So the cervix connects the vagina to the uterus, and the uterus we commonly think is where we hold the pregnancy. It's really an important, highlighted piece of health because we have an excellent screening tool to detect cancer. And if you think about cancer in general, how often do we say we have an effective screening mechanism to detect early cancers and to treat them to cure patients of their cancer. So it's an important awareness month, but hopefully it's just a small piece of the whole year to promote your health.
Okay, and when you're saying getting screening, if someone's watching this at home, who's at risk? Who should really be thinking about this?
Yeah, cervical cancer is one of the biggest risk factors is the human papillomavirus. So anyone who is having, sexual relations is at risk, but that's not the only risk. Okay. So anyone in general who has an compromised immune system, we think of those individuals that are on medications, maybe someone who's on transplant medications or HIV or AIDS, but also smoking. Cigarette smoking is a huge risk factor that people can, make a decision and promote their health, quit smoking, and that absolutely reduces your risk for cervical cancer.
Okay, and what are some maybe symptoms that people should be on the lookout for?
Yeah, symptoms of cervical cancer are actually quite vague, but they may present as vaginal discharge, vaginal bleeding, spotting, pelvic cramping, and more advanced stages, actually, cervical cancer can present in weird ways, like lower back pain, and oftentimes swelling in the lower legs that's unequal. That also could represent more later stages cervical cancer.
And let's talk prevention, because this is one of those rare cancers that it almost has a cancer vaccine. So it's the HPV shot, correct?
That's right, yeah.
Okay, and so I know if people didn't get it in their teens, do they need to get it now? What are the ages of getting that vaccine?
Yeah, so we are looking to provide the most effective age group, and that's the 11 to 12-year-olds, both boys and girls.
Okay,
now.
boys and
girls. But people can get it as early as age 9 up to age 26. And then more recently, actually, we looked at, is there additional benefit in providing older individuals an HPV vaccination. And so up to age 45, we're encouraging everyone to talk to your providers, ask them about the benefits, the risks, because it is an opportunity that I think not many other cancers can offer, but we can prevent cervical cancer, and the vaccine is a way to do it.
Yeah, and that's just something that's so simple, right? So we have just about 30 seconds here, but I want to read the title of this upcoming podcast, Fertility and Cancer, What to Expect When You're Not Expecting. So I'm excited, and I know it's you and it's your patient, correct?
Yes.
Okay, and it sounds like it's going to be a beautiful story. She had cervical cancer, and it kind of talks about her journey with fertility. So
absolutely,
you're not going to want to miss that, everyone. So you can find further information right there on your screen. This is Cancer Podcast. It is available now, and be sure to reach out, make an appointment to your provider. All that information for Siteman's right there on your screen. Thanks again for joining us today.